Hello, this is Dr. Gabe from First Look MRI, and this is a 79-year-old male with complaints of chronic wrist pain, and he has several problems. One here we see on the side view. There's lots of motion, unfortunately, but we see that there is fluid back over here along the back of the wrist around one of these extensor tendons. So this is tenosynovitis. The fluid is distending the tendon sheath. That's just one finding we have here. Another finding on this side view here, or sagittal view, we see that the carpal bones are here. These are the carpal bones here. We see the distal radius right here. We see the radius here. And we see the lunate bone right here. We see the lunate bone here. Now the lunate bone is tilted backwards, dorsally tilted. It's a little cup in this bone called the capitate bone. Should sit right here in the middle, but instead this is tilted backwards. And we call this dorsal intercalated segmental instability. It means that the ligaments are injured and this is not a normal orientation. It'll tilt backwards and this capitate bone can become abnormally positioned like it is now. It's not sitting right in the middle, it's backwards. So this is a severe problem with the ligamentous instability, where the bones are getting out of alignment. And this is also associated with something we see better on this. The abnormal tilt here, the ligamentous instability, is associated with a tear of a ligament which is right here. This is the scapholunate interspace. So the scaphoid bone and the lunate bone have a ligament called the scapholunate ligament, and that is torn. That ligament will hold these two bones close together, but you can see how there's a big gap between them because that the ligament is ruptured. And when that's ruptured, this bone can drift downward. This is called the capitate. And this can drift down, down, down between these two bones and cause them to widen and separate, like it has happened here. And this capitate bone is actually touching the radius. Normally it's held far away from the radius by this bone. So this is an abnormal configuration related to rupture of this ligament, the scapholunate ligament. The capitate bone is migrating proximally, causing widening here. And also this scaphoid bone is abnormal. It's all deformed, small, and has contour irregularity. Normally it's bigger and smoother. And so this is chronic erosion from the abnormal mechanics of stress. This has also eroded the distal radius. The radius, instead of having a flat, nice articular surface, has a scooped out area. So this scaphoid bone is being driven into this and it chronically eroded that bone. So this is what we call a SLAC, S-L-A-C wrist. It's a scapholunate advanced collapse is the term they give it. And that basically means that the scapholunate ligament is torn, capitate bone is migrated down, there's abnormal mechanics of stress, and you get these bone erosions and arthritic changes related to the abnormal pressures related to this ligament not functioning. So kind of a complex case of a scapholunate ligament rupture with dorsal segmental instability here, dorsal tilt of the lunate, and a SLAC wrist, which means the developing arthritic changes. And that's it. Thank you so much.